And welcome back to 2-Minute Teas with TP. I'm Teresa Pun, and instead of tea, it's far too hot. I'm still just enjoying simple tap water. I've done a previous video on penicillin allergy, but I want to speak a bit more on cephalosporins. This is a family, a very large family of antibiotics that is about 5 to 10% related to the penicillin family. Now, in the past, we thought that these two families were much more closely entwined, maybe to the degree of 25% cross-reactivity. But even at 5 to 10%, it is still very important for patients with a penicillin allergy to also avoid cephalosporins. And again, we're not talking about a tummy ache or a little bit of vomiting. We are talking about a very real risk of a life-threatening reaction to taking a cephalosporin if you have a history of a penicillin allergy. Now, I know I've said it before, and I'll say it again. Penicillin or true drug allergies are extremely rare, but they do exist. And if you haven't been assessed properly, you might have a very real penicillin allergy, which means, again, safety first, you avoid cephalosporins. Sometimes people with a history of a penicillin allergy need a surgery, and the pre-op antibiotic of choice is often Ancef, a first-generation cephalosporin. Now, the risk of a reaction is actually higher with first generation versus some of the other generations of cephalosporins. These patients may often come to me, and what I do then is I assess for the validity of the penicillin allergy, because if I can definitively eliminate that, then there's no need for cephalosporin testing. That person goes back to being an average person in the general population, and they can go on to receive the most ideal preoperative antibiotic of their surgeon's choice. So I hope you found this helpful, and I will see you again.